The arrival of the Omicron variant is a reminder the novel coronavirus is always evolving. CBS 4's Katie Weiss wanted to know about how it mutates, so she sat down with an epidemiologist to find out why some variants are more dominant than others.
Denver's lead epidemiologist tells me the first variant of COVID-19 in the world, the Alpha variant, wasn't identified until fall 2020, months after the original COVID-19 virus emerged. Since then, we've seen several new variants, some more dominant than others. Here's our full interview.
How do viruses mutate? Specifically, how does the coronavirus mutate?
Sure. Um, so coronaviruses are essentially segments of genetic material. So in this instance, it's RNA. On the outside of these viruses, there's a bunch of proteins. So in this instance, for coronaviruses, they're called spike proteins. So the spike protein is what makes that specific virus unique. That's what, when it infects your body, your body's identifying, hey, this is COVID-19. When viruses are transmitted from person to person, every single time that virus moves to a new person, it's replicating itself over and over again. And there's a chance for an error to happen. So if you kind of think about if you're a kid and you're playing that telephone game with your friends where you're either, turning to your friend and whispering something or, using the cups, as that message gets passed along enough people, there's gonna be things that change. And by the time you get to the very last person, the message probably sounds or looks a little bit different than what it looked like at the very beginning. A lot of the times when these small changes are happening inside of the virus, it doesn't result in any change to the disease itself or the outcome. Most of the changes that happen are pretty benign. Sometimes there can even be changes that happen that make a virus weaker or make it not infect as many people. And then we tend to see those versions of the viruses start to die out more. When we start to get changes that happen that make viruses stronger, so in instance, if you think of the Delta variant, we saw mutations in the spike proteins that were associated with increased rates of transmissibility. So more people were being infected. And then we also saw changes in how people were responding to monoclonal antibody treatment. Part of the reason is that treatment is made looking at the original spike protein of COVID. And as COVID starts to mutate over time, like I said, it starts to look a little bit different. If it looks different enough, your immune system doesn't quite recognize the fact, hey, this is COVID. I may have already been infected with this before and have some natural immunity, or I may have been vaccinated against this and have vaccine-related immunity. And that's where we can start to get changes in, more people who are already vaccinated becoming infected, or those treatments that have been developed not being as effective. So with the new Omicron variant, what we're seeing is that there have been mutations in that spike protein where other variants that have been reported, so looking at Delta, Alpha, Beta, we've seen some of these mutations before, and we know that some of them are likely associated with things like increased transmission and evasion from your immune system. But when we get new combinations of mutations, we never know exactly what that outcome might be. We can look at one mutation by itself and say, hey, this by itself might make it more transmissible, but that mutation combined with 15 others may not make it more transmissible. And that's why with the Omicron variant, we're still trying to understand exactly what some of these characteristics are going to be. We can take some educated guesses. We don't quite know yet until we have a chance to look at the data. So essentially what's happening with viruses that are mutating, it's just kind of errors that are happening as it replicates. And the reason why we push vaccination as such an important step in reducing overall transmission is because people who are vaccinated overall are less likely to become infected with COVID. So it's kind of like, I saw an analogy that the state put together where they had layers of Swiss cheese. And, you have some holes in the Swiss cheese, but when you layer enough of those methods, things tend to not get through. So if you're looking at masking is one layer, social distancing is one layer, vaccination is one layer. Some things can get through some of those holes, but when you combine them all together, it's a really good way to protect in general. So the way that we can reduce mutations from happening in the future is to reduce the number of people that are being infected and reducing the number of opportunities that exist for the virus to have those errors that occur as it's transmitting from person to person.
I was reading from somewhere else that it's similar to like when someone copies a manuscript, there's going going to be typos, and that some of those typos can be helpful to the virus and some of them can weaken it. Could you talk a little bit more about how that process works?
Yeah, so you can kind of think a good example I saw, the WHO put out an example. So if you're thinking of like a bike lock, you have three options and you have a specific combination that makes that lock unlock, but you have a wheel that has other options. So say our 3-digit code is, CAT, let's go with cat. As it's being transmitted from person to person, you're getting that message, so that cat going from person to person. But there's the opportunity for those little wheels to kind of loosen or fall. And, instead of you having CAT, maybe you end up with CGT that moves on to the next person. So those combinations can look a little bit different. Overall, your body is still recognizing, this is COVID-19, and that's why we call them variants and not strains. They are still indicative of this is COVID-19. It's just a slightly different version. But that bike lock example is a good one. If you look at COVID, you're kind of thinking of COVID has like 30,000 of those locks. You have 30,000 of those little 3-digit combos that are happening, and it's so easy for just one letter to change, and then that can change something in the genome of the virus to make it potentially more transmissible, or some of those other things I talked about. So a lot of times, that example of writing a manuscript and you just have an error, or say, you're writing down an address and you flip the house number and you end up at the wrong house, even kind of minor changes can either be really beneficial and make the virus spread more, or they can do the opposite. They can weaken that virus and make that version die out.
That's so interesting. And you just brought up a great point, where I think a lot of people might get this mistaken. What's the difference between a strain and a variant?
Sure, that's a good question. So with variants, genetically, it's still COVID-19. It has the same disease characteristics. The overall genome looks relatively the same, and that's what we call a variant. So it's still COVID-19. When we talk about strains, essentially a strain is just you have enough mutations that accumulate that genetically it starts to look a bit different, and disease characteristics start to look a bit different, that they're distinct. And that's when we want to separate them and say, hey, these aren't quite the same overall, so we're gonna distinguish these from each other. But overall, if you're looking at Delta versus Omicron versus Alpha versus Beta, a lot of the variants that have been reported genetically, they are all still pretty similar.
In general, like when did we first see the Alpha strain, and now here we're at Omicron? About how much time has passed, through those various variants?
Yeah, that's a great question. We had the Alpha variant was first identified last fall, and we had the first case in the United States in late December of 2020. And now we're in December of 2021. Looking back, when Omicron was first discovered was November. So it's about 11 months between when Alpha, that first variant, was reported on as a variant of concern, to where we are now with Omicron. And we've obviously had a progression of variants that have popped up, and some of them are more concerning than others. Delta, Beta happened pretty quickly after the Alpha variant. So that was early spring. I'm thinking maybe February or so. The Delta variant started becoming a variant of concern late spring, early summer. And we saw the effects of Delta in Colorado really hitting us starting in August of 2021. So a couple of months ago. And we've continued to see Delta was so much more transmissible than other types of COVID. The estimate now is maybe 2.5 times as infectious. So when Delta started circulating in the United States and in Colorado, we pretty quickly saw that variant started to overtake all of the other ones, and that became the predominantly circulating strain. There's some preliminary data out of South Africa that's showing that Omicron looks like it's doing something similar, where it is starting to outcompete Delta. And I think they had also seen a few Beta cases over the last couple of months, but we're starting to see Omicron outcompete those, which likely means it's more transmissible, but no definitive data yet to prove that.
Okay, good to know. And then, I understand that a lot of these variants originated in different geographic areas. For example, what we're seeing with Omicron now, it seems to have originated in the South Africa area. So can you talk about how does geographic separation result in this evolution of the virus?
That's a great question. I think one of the interesting things is, differences in demographics of populations. Some of the things virologists have shown is when you're looking at mutations of viruses, if you have somebody that's really immunocompromised and their immune system can't do a great job to fight something off, that's giving that virus more opportunity in your body to replicate. Potentially, if you have, this happens sometimes with flu, where you have something called a shift, where you may have two strains or variants that kind of meet, and then you end up with a new one. I don't know of any evidence that that's happening with COVID necessarily. That does happen with influenza and some other viruses. In terms of geographic distribution, obviously it takes a little bit of time for it to start to kind of take over. But one of the things that we saw with Delta, especially with travel is so common. People are so mobile now, and populations going to all different places. And especially when you're talking about respiratory diseases and how they can spread through coughing, sneezing, talking, potentially living on surfaces, there's just a lot of opportunity for transmission to occur and a lot of opportunity for people to be exposed to these types of viruses. And with new viruses, it's something your body hasn't seen before. So if you grow up getting flu vaccines, being exposed to flu, your body's building a little bit of immune system, and it changes over time and your body starts to recognize it. That was one of the things with COVID. No one had ever had COVID-19 before. Even as a kid, you didn't have a chance to kind of build that immune system. So I think it's hard to say necessarily looking at like distinct populations and how variants are happening, if they're happening more in certain populations or certain geographic areas. I think we would likely anticipate that areas with higher rates of transmission will have higher possibilities for mutation, which could lead to the emergence of variants. So there could be a connection there, looking at overall case rates by geographic region and the emergence of these, and then people traveling and kind of going all over the place. And I think that's one of the things with travel restrictions. When we look at, we know that we can't stop the spread of COVID-19 completely. That's never going to happen. It's the same thing with flu. But what we can do is just buy ourselves a little bit more time to try to learn more about it, learn about the disease characteristics, potentially prepare hospitals, expand hospital capacity. We can do traveler monitoring to try to reach out to people's contacts faster than what we might be able to if we weren't kind of really honing in on that piece. So it just helps us buy a little bit of time. I did also see some data yesterday looking at the genetic lineage of the Omicron variant, trying to understand where it could have been derived from. And one of the things that was really interesting was that it looks like it's derived from variants that were circulating in 2020, or versions of COVID-19 that were circulating in 2020. And there is evidence that it has been circulating for at least a little bit before it was noticed, or before it was detected through sequencing. So it's not like, when it was sequenced, that was the first case that's ever happened. It had likely been circulating for a little bit. And we're now also starting to see data out of areas in Europe of people who are testing positive for the Omicron variant who have no travel history. So that's a community acquired case outside of South Africa and countries around South Africa.
What can prevent further mutations from happening?
So the number one thing that can prevent mutations is people getting vaccinated. Getting vaccinated is the number one way to stop not only becoming infected with COVID-19, but developing severe disease. And we know that if we're layering these approaches, so we have vaccination, number one goal. We also have, now in the metro region, we have the mask mandate for people to wear face coverings. Layering that with social distancing, layering that with vaccination, kind of all of these steps together are what we can do to reduce transmission. If we're able to reduce the overall number of people that are becoming infected with COVID-19, that is lowering the chance for that virus to mutate at every step. Every person that becomes infected, that's a chance for the virus to mutate. So if we're cutting down that number, we're taking away those opportunities, and there won't be as many mutations, there won't be as many variants. So definitely get vaccinated if you're able to. Encourage your friends and family to get vaccinated if they're able to. Wear a face covering if you're in indoor public settings. Social distance if you're able to. All of those things together will do a great job of reducing your overall risk of transmission and the rate of mutations.
Tori, thank you so much for your time. Is there anything else you'd like to add that maybe I neglected to ask that you think is important for people to know today?
I think that's it. I think, I'll just hone in on that message again for people to get vaccinated, get your booster vaccines. I maybe didn't mention specifically booster vaccines. There was an announcement just recently from the feds encouraging all people over the age of 18 to get a booster vaccine if they're eligible. So I'd encourage people to do that. That can help reduce your risk of getting COVID-19, you reduce your risk of having a severe outcome, so being hospitalized or dying from it. If you're in Denver, the Denver metro region, and you're in indoor spaces, make sure you're wearing that face covering in places where that's required to help reduce that spread, and just try to, be smart, social distance if you can, get tested if you've been exposed or have symptoms, kind of all of those general recommendations. We're going to keep hammering them in because we know they work, and we hope people listen. But I think that's about all I have.
Burkett also tells me the flu virus mutates about 4 times as fast as the coronavirus, which is why there are new flu vaccines every year. For COVID-19, she stresses it's critical to wear your mask and get vaccinated or boosted so you have the full blanket of protection ahead of Omicron's arrival. I'm Katie Weiss in the newsroom.